Hello everyone, welcome to a new session in cardiovascular system pathology. So, in the previous videos, we were discussing about the common vascular pathologies like hypertensive vascular disease, atherosclerosis, aneurysm, dissection, that is aortic dissection, all those. In this video, I would like to discuss about vascular tumors. See, what are vascular tumors? The tumors of blood vessels and lymphatics. That is very important. Okay, we will be discussing the tumors of blood vessels and lymphatics. Fine. Before going into the topic proper, let us see what is the classification of vascular tumors and tumor-like conditions. Remember, we are going to classify them into benign, intermediate, finally malignant. Okay, yes. Benign, we have hemangioma, number 1, number 2 lymphangioma, number 3 glomus tumor, number 4 vascular ectasia. Don't worry, each terminology I will be explaining. And 5 some reactive vascular proliferation. Coming to intermediate grade neoplasm, we have Kaposi sarcoma, very important, in depth and in detail we will be discussing. Hemangioendothelioma. And third, we have malignant neoplasms, that is angiosarcoma and hemangiopericystoma. Fine? Yes. In hemangioma, we have 3 entities: capillary, cavernous, pyogenic. In lymphangioma, again we have simple or capillary lymphangioma, cavernous lymphangioma, also called as cystic hygroma. Yes, cystic hygroma you will get in Turner's syndrome, 45X0. Then glomus tumor, which arises from the glomus bodies. What are glomus bodies? They are arteriovenous anastomotic shunts, which are present in the tip of our digits, thumb, all those, mainly help in thermoregulation. Vascular ectasias, then reactive vascular proliferation. Let us go one by one. Okay, yes. Fine. So, just a word about benign tumors and malignant tumors. Benign tumors, they have obvious vascular channels. They are filled with blood cells, and they are lined by normal appearing endothelial cells. Malignant tumors, they will exhibit what? Cytological atypia. Am I right? They won't resemble the normal blood vessels, and they test positive for some endothelial cell specific marker called CD31. So this question can be asked as a potential MCQ question, and this has been asked in JIPMER few years back. What is that? CD31 is the immunohistochemistry marker, IHC marker for malignant tumors of vessels. Now let us see what are the benign tumors and tumor-like condition. First of all, what do you mean by ectasia? Ectasia means it is an dilation of a structure. We have something called as telangiectasia, which is a permanent dilation of small vessels and arterioles, okay, in the skin and mucous membrane, which will form a characteristic red lesion. Fine? Yes. That is the first entity. That is what we call it as ectasia. Okay, that is number 1. Number 2 is what we call it as nevus flammeus. See, nevus flammeus is nothing else but the birthmark. It is the most common type of vascular ectasia. It will be light pink to deep purple, flat lesion. Okay, head or in most commonly is in the head or neck region, which is also made up of dilated vessels. It is the birthmark. Okay, most of us have this. Yes, we have something what we call as port wine stain. Okay, what is port wine stain? And actually this port wine stain is characteristically seen in what we call it as Sturge-Weber syndrome. It is also called as encephalotrigeminal angiomatosis. Okay, yes. Okay, this is Sturge-Weber syndrome, and remember what it is associated not only with the presence of what we call as port wine stains, okay, which is characteristically present over the face, but it is also associated with what? Central nervous system disorders like what? Cortical leptomeninges, intellectual disability, seizures, hemiplegia, and skull radiopacities. Fine? Yes. So what is the reason behind this Sturge-Weber syndrome? You should know the reason behind this because of missense mutation in the GNAC. Okay, the alpha subunit of a transmembrane signaling molecule that is called as GNAC. Okay, what is that? GNAC. GNAQ. It's a signaling pathway. Okay, remember the stain, that is the port wine staining. Okay, over the face, especially what to say. These lesions, okay, is most commonly seen in the distribution of trigeminal nerve in the face and also associated with CNS manifestation. Then we have something what we call it as, okay, we have something what we call it as spider telangiectasia. Spider telangiectasia means there will be a center and there will be radiating arterioles, okay, dilated arterioles like this, okay, which will resembles the spider leg, and there is a central core which resembles the spider body, okay. And remember, this will blanch with the pressure. This is most commonly seen. See, spider navy, I am writing here, spider navy is one of the marker for hepatocellular failure, liver cell failure. In medicine, you will learn it is one of the markers of liver failure. We have other gynecomastia, alopecia, everything. This is one of the spider angioma or spider navy is one of the liver cell failure marker. Okay, that means what is that? If this is present, we can say that the patient is having hepatocellular failure. It is an external marker of an underlying pathology. Okay, I hope this is clear for you. Yes, hepatocellular failure, spider navy. Okay, yes. So it is also associated with hyperestrogenic states. Hyperestrogenic states, that is in cirrhosis. Even in cirrhosis, we have hyperestrogenism, and even in pregnant women. Then we have something what we call it as Osler-Weber-Rendu disease. It is also called as HHT. What is HHT? Hereditary hemorrhagic telangiectasia. Remember, Osler-Weber-Rendu syndrome, it is an autosomal dominant disorder which occurs because of transforming growth factor beta mutation. So there will be multiple hemorrhagic dilated capillary, that is what we call as telangiectasia, which will be distributed in the skin, oral mucous membranes and all. And there will be, and why it is called as hemorrhagic? Because these dilated blood vessels which are present over the skin and mucous membrane, they can undergo spontaneous rupture, which can cause a serious epistasis, that is the nose bleeding, gastrointestinal bleeding, and or hematuria. Okay, now let us see the benign tumors proper. Out of that, the most one important is very common is what we call as hemangiomas. I told you that the benign tumors, they almost resemble like a normal blood vessel. So the hemangiomas, they are very common tumors which are composed of blood filled vessels. Okay, yes. And what are some of the common locations of the hemangioma? See, I remember these hemangiomas, they will be present by birth, and the size of this hemangioma may increase. Okay, and this patient may approach us when he reaches and what to say like an adolescent age. Fine. So they are typically confined to head, neck and thoracic skin. Okay, it doesn't mean that it can't arise what to say internally, but mainly, okay, it occurs over the head, neck and thoracic skin. Fine. We have different histological and clinical variants. Out of that, the most common type is what we call as capillary hemangioma, which occurs in the skin, subcutaneous tissue and the mucous membrane of oral cavity, lips, as well as in liver, spleen and kidney. And histologically, what we can see something called as a thin-walled capillary with a scanned stroma. Okay, I will be showing the. See, this is it. This is a capillary hemangioma, gross as well as histology. Okay, see, this is the hemangioma of the tongue. This is the hemangioma of the tongue. Okay, this is, you can see the Scandi stroma. Okay, this is a cut section of the blood vessel with the Scandi stroma. Okay, fine. Yes. See, capillary hemangioma is very difficult to identify histologically. Fine. So, but see, what is this entity? You can see spaces. You can see lots of spaces. So, definitely these are cavernous hemangioma. This is cavernous hemangioma. And the last entity is what we call as pyogenic granuloma, which occurs in the lip. It doesn't mean that it can't occur in the other region. Pyogenic granuloma is very common in, okay, the same pictures they may give in entrance exams and they may ask this. So pyogenic granuloma of the lip. Okay, yes. So we have something called as juvenile hemangiomas, also called as strawberry type hemangioma. That means this is present in the newborn skin. Okay, present in the newborn skin. Then we have something called as cavernous hemangiomas. I have already told you cavernous hemangioma means it is composed of large dilated vascular channels. Am I right? Yes. And remember, in contrast to the capillary hemangioma, this cavernous hemangioma, okay, the cavernous hemangioma, they are more infiltrative. They can involve the deep structures and they won't regress spontaneously. On On histological examination, we can see large cavernous blood-filled vascular spaces which are connected by connective tissue stroma. See, we can see, these are the blood vessels, and what I am marking in red, this is nothing else but the connective tissue stroma. Okay, this is the connective tissue stroma. Fine, yes. And remember, this cavernous hemangioma is one of the most important component of VHL. What is that? Von Hippel-Lindau disease. Okay, there will be a lot of vascular lesions in the cerebellum, brainstem, retina, pancreas, and liver. Okay, fine. Next, we have something what we called as pyogenic granuloma. How will you identify it is a pyogenic granuloma? Remember, actually, this pyogenic granuloma is also nothing else but it's a variety of capillary hemangioma, but it occurs like a red pedunculated lesions, mainly on the gingiva or oral mucosa, and they can bleed easily and they are often ulcerated. Fine? Yes. And remember, what is the characteristic history of pyogenic granuloma? P4P. That means this is more common in pregnancy. This is more common in pregnancy. So whenever a pregnant lady comes with a history of red pedunculated lesions on the oral mucosa, okay, we have to always think about pyogenic granuloma. And this has been a case scenario based question that has been asked in AIIMS, okay, previously. Fine. So this is very, very important. Yes, this is, so the pregnancy tumor, that is what we call as granuloma gravidarum. It is also a type of pyogenic granuloma. Okay, just remember, pyogenic granuloma, it is more common in what we call it as pregnancy. See, this is the lip, you can see. Okay, sorry, I'm drawing with violet color. You can see the ulcerated lesion. Okay, this is classical ulcerated red pedunculated lesions. Red pedunculated lesions. Red pedunculated lesions, more common in pregnancy. Okay, whenever there is a history of pregnancy, okay, and the lesion occurs in regions like gingiva, okay, and oral mucosa, you have to always think of pyogenic granuloma. Okay, yes. Fine. So once that is done, we have something called as lymphangiomas. Lymphangiomas may be again capillary lymphangiomas. Another one is called as cavernous lymphangioma, also called as cystic hygroma. So again, almost what the difference here is, there we have blood, here we have lymph, that's all. Okay, yes. So this is most common. Capillary lymphangiomas are most common in head, neck, and axillary subcutaneous tissues. Okay, and yes. So how we can distinguish this capillary hemangiomas and capillary lymphangiomas? This capillary lymphangiomas shows expression of some important markers like VEGFR3, LYBE1. Okay, these are the two important markers that help us to distinguish between capillary hemangioma as well as cavernous hemangioma. Okay, just remember this. I am writing it as an MCQ. They may ask this question. Then cavernous hemangioma. Okay, remember this is most commonly in neck, and I have already told you cavernous hemangioma is in what syndrome? Turner's syndrome. Okay, very, very important point. Okay. Once this is done, what is glomus tumor or glomangioma? It is this is nothing else but the benign painful tumors. Okay, very, very important. They are the painful tumors which arise from the glomus bodies, which are nothing else but the arteriovenous structures which are involved in thermal regulation. It occurs at the phalanx, thumbs, okay, fingernails, everything. Okay, very, very important. Then we have something called as the reactive. What to say? Yes, we have in the classification we have reactive vascular proliferation. The one which belongs to this class is what we call as bacillary angiomatosis. Remember, this is nothing else but a vascular proliferation in response to an infection in immunocompromised individual. This is caused by Bartonella henselae and Bartonella quintana. So these are the two species. That is the Bartonella henselae, okay, which causes the cat scratch disease, which is nothing else but in cat scratch disease. What is the type of granuloma? Yes, can you recollect and tell? It is a stellate granuloma. It is a star-shaped granuloma. So in immunocompromised patient, okay, in response to the Bartonella henselae and Bartonella quintana infection, there will be what? It's the response of the body towards that infection in the form of vascular proliferation. Okay, this occurs mainly in immunocompromised host. This is called as bacillary angiomatosis caused by Bartonella quintana and Bartonella henselae. Bartonella henselae characteristically causes cat scratch disease, which are a hallmark type of granuloma. We call it as stellate or star-shaped granuloma. Okay, yes, I will show the picture of this. See, this is the characteristic picture. You have to remember what is that? Bacillary angiomatosis. This is a characteristic cutaneous lesion. Okay, how will you describe this lesion? They are nothing else but red papules. Okay, with the rounded subcutaneous masses. You can see the papules. What do you mean by papules? They are elevated, palpable. Skin changes. That is what we call as a papule. Okay, so you can see a rounded mass. Okay, this is a papule. Very, very important. And histologically, what you can see neutrophilic infiltration. See, neutrophilic neutrophilic infiltration. Why? Because it is an infection. And of course, you can see vascular vascular proliferation. And the most important hint they will give you is that the organism can be demonstrated by what is this silver staining. You know, Bartonella can be seen by Warthin steri silver staining. Okay, Warthin steri silver staining, very, very important. Bacillary angiomatosis. Okay, yes. So what is the reason? What is the reason for this vascular proliferation? Again, because of the stimulation of or excess production of vascular endothelial growth factor by the stimulation of hypoxia inducible factor 1 alpha. Okay, remember this point. Yes. So far we have finished all the benign tumors of the blood vessels. Now I am going to discuss about the intermediate grade or borderline tumors. Out of that, the most important, the topic that has to be properly in depth to be discussed is nothing else but the Kaposi sarcoma. So whenever you heard the word Kaposi sarcoma, the first thing which comes into your mind is HIV. Yes, it is a vascular neoplasm which is caused by, what is the name of the virus which causes it? Is human herpes virus 8. It is also called as Kaposi sarcoma herpes virus. It is most common in patients with AIDS. Okay, very, very important. So whenever in the clinical case scenario, they give a history of a HIV patient who is going to have what? I will say how this Kaposi sarcoma will look in gross and histologically. Okay, you have to always make a diagnosis of Kaposi sarcoma. We have 4 different varieties of Kaposi sarcoma. Number 1 is the classic variety. Number 1 is the endemic variety. Then we have the transplant variety, and finally is the AIDS associated or epidemic variety. Okay, fine. So the classic Kaposi sarcoma, it is more common in the Mediterranean region. Okay, remember classic, it is not associated, very, very important, it is not associated with HIV infection. It occurs as a multiple red purple skin plaque or nodule, mainly in the distal extremities. This will progressively increase in size. Okay, very, very important, and they will mostly remain asymptomatic. We will see the picture of Kaposi sarcoma. See, this is how the Kaposi sarcoma, you can see, coalescent red purple macules and plaques of the skin. Okay, it is not a mass. Okay, the bacillary angiomatosis, it appears like a nodular mass, very, very important, where it is here it is a red to purple colored plaques, okay, or macules which is present in the skin. Okay, fine. And you can see in histopathologically, you can see okay, you can see what? Lots of sheets of spindle shaped cells. Okay, what are they? These are the sheets of spindle shaped cells. Okay, sheets of spindle shaped cells. So once again I am repeating, in the classical variant, okay, it is not associated with HIV, seen in Mediterranean region, red purple skin plaques or nodules in the distal or lower extremities, gradually increase in size. What about the endemic or the African variety? Again, it occurs in HIV negative individuals. Okay, yes, but what is the major difference between this and the classical variety is that it is more having an aggressive course. Okay, it is having more aggressive course. Fine, that is the only point. Then another one is called as transplant associated, that is after organ transplant because of immunosuppression. Okay, you can get this, and here also it follows an aggressive course, and it is involving lymph nodes, mucosa and the viscera, very, very important. So there is a visceral involvement in case of transplant associated Kaposi sarcoma. And the most important thing is the epidemic Kaposi sarcoma, that is the AIDS associated Kaposi sarcoma. It is an AIDS defining illness. That means if Kaposi sarcoma, or what to say, in AIDS patient, definitely there may be Kaposi sarcoma. It is one of the most common HIV related malignancy. Very, very important question. The most common HIV related malignancy is what? Kaposi sarcoma. Am I right? Yes. Okay, fine. Again, what it may undergo dissemination, it will be associated with other opportunistic infections and so. Okay, what happens actually? What is the pathogenesis? I told you that the Kaposi sarcoma is caused by human herpes virus 8. Okay, we have another one member of this gamma herpes virus, that is called as Epstein-Barr virus. Okay, both of them belongs to gamma herpes virus family. Okay, so there should be a diminished T cell immunity for the patient to acquire this infection. That is why I call it is an immunosuppression. HIV is an immunocompromised state. Okay, so what is going to happen? So this HIV is going to cause some lytic and latent infections in endothelial cells. As a result of this, a virally encoded G protein, which will induces the VEGF, vascular endothelial growth factor production, which will cause this what? Proliferation of the blood vessels. Fine, very, very important. Okay, and this occurs by inhibiting P53 and also through synthesis of viral homologue of cyclin D. Cyclin D is a it helps in cell cycle progression. So it will stimulate cell cycle proliferation, progression, and at the same time it is going to inhibit P53. P53 is a tumor suppressor gene. When the tumor suppressor gene is inhibited, what will happen? Automatically the cell cycle will progress. That you know already. So this is the pathogenesis. Fine. Yes. So now let us see what is the morphology. Okay. Yes. Remember. In classic type of Kaposi sarcoma, the lesions progress through 3 stages. I told you, red to purple macules or plaques. Yes, it is not occur suddenly. We have some stages. What is that? Number 1, patches. What is that? Patches. What is patches? They are red purple macules. I have shown the picture, no? Red purple macules. Yes, you can see here. These are red purple macules. Fine. Yes. So histology shows some dilated endothelial cell lined vascular spaces with interspersed plasma cells, lymphocytes and macrophages. Fine. Yes. Then the second stage is these patches may progress to form some violaceous, that is violet color, raised plaque. This is because of dermal accumulation of vascular channels which are lined by spindle shaped cells. Okay, and among this we have hemocytin ladder, macrophages and all those. This, I told sheets of spindle cell. This is actually nothing else but what we call as the plaque stage. Okay, this is the histology of raised plaque stage. Okay, plaque stage. They may ask this question. In plaque stage only we can get the sheets of spindle shaped cells, and these plaque may progress to become what we call it as nodular, and they resembles like a neoplastic condition. Here also we can see sheets of plump proliferative spindle cells in the dermis and subcutaneous tissue. We may have small vessels with slit-like spaces. We will have multi-hemorrhage or hemosiderin pigment, mitotic figures. All the features of malignancy may be present. Okay, this is actually a classical. See here, you can see. I'm going to erase all these things. Okay, I'm going to erase all this so you can visualize this picture. You can see that almost the whole of the the blood vessels are completely filled with what we call it as sheets of spindle shaped cells. Sheets of spindle shaped cells. Fine. Yes. Okay. Fine. So coming into the clinical features, I told you that this is the clinical features. Mainly remember how the patient will present with, that is coalescent red to purple macules and plaques of the skin. You can see mainly over the extremities. Okay, this doesn't mean only on the extremities, mainly in the lower and distal extremities. Fine. Yes. Then the second intermediate or borderline tumors is what we call as hemangioendothelioma. Remember, hemangiopericytoma is a malignant tumor of the blood vessel, whereas hemangioendothelioma, it is a borderline tumor. Kaposi sarcoma is also a borderline tumor. That means it falls between benign and malignant categories. So epithelioid hemangioendothelioma, it is a tumor of adults occurring around medium and large sized veins. Very, very important. Okay. Yes. And okay, fine. And we have well-defined vascular channels are inconspicuous, and neoplastic cells are plump and often cuboidal. That means they resembles like epithelial cells. Okay, that is why it is called as epithelioid hemangioendothelioma. Okay, I hope you are clear. Usually, but endothelioma means what? You should remember about endothelial cells. But here, because of the neoplastic cell proliferation, the endothelial cells becomes plump and it looks like epithelial cuboidal cells are resembling the epithelial cells. That is why it is called as epithelioid hemangioendothelioma. Just remember, there is no need that you have to know about this in depth. Just remember that epithelioid hemangioendothelioma is a type of borderline or the intermediate tumor of the blood vessel like the Kaposi sarcoma. What about the malignant tumors? We have something called as angiosarcoma. When it comes sarcoma, you can of course remember it is a malignant variety. Fine. Yes. Okay, so this is angiosarcoma most commonly occurs after radical mastectomy for breast cancer. So in the clinical case scenario, they will give a female who is diagnosed with breast cancer undergo radical mastectomy. After that, she undergo dilatation of the blood vessel and so and so. So immediately you have to make a diagnosis that it is a angiosarcoma, or sometimes if it arises from the lymphatic vessel, we call it as lymphangiosarcoma. Okay, yes. And we have something called as hepatic angiosarcoma, which occurs mainly because of chronic exposure to what we call as thorotrust. Very, very important. Continuous exposure to thorotrust also leads to what we call as hepatic angiosarcoma. I have already discussed about this in thorotrust, vinyl chloride. All these causes hepatic angiosarcoma. I have discussed in neoplasm chapter. Fine. See, and polyvinyl chloride, one of the best known examples of human chemical carcinogenesis. Okay, that is angiosarcoma. Okay, they can undergo metastasis. So what the survival rate is very low. So what you can see multiple red papules or nodules. Okay, they are advanced lesions. You can see hemorrhage. There will be a the surrounding tissues will be affected. Okay, and plump atypical endothelial cells. They are undifferentiated tumors and histochemical IHC. I have told initially itself. What is that? Endothelial origin of this tumor can be demonstrated by what is the IHC marker for endothelial tumors? Very good. It is CD31 or von Willebrand factor. Fine. See, you can see this picture. This is an angiosarcoma. Okay, this is an angiosarcoma which involves the right ventricle. Okay, right ventricle. This is moderately differentiated. We have well differentiated moderately differentiated and poorly differentiated type of angiosarcoma. These are the three histological variants. Well differentiated means it almost resembles like a normal blood vessel. Here it is moderately differentiated because only some areas resembles like a normal cells. Rest areas it's different. And poorly differentiated means no, you can't identify that it is a normal blood vessel. Fine. And see, this is the IHC staining. This is the IHC staining for CD31. Another one marker is von Willebrand factor. Okay, von Willebrand factor. Von Willebrand factor. Sorry, VWF. Okay, von Willebrand factor. Fine. Yes. You can see a dense clumps of atypical cells with vascular lumens, and see, these are the lumens of the vessels. Still, you can visible the lumens of the vessels. Wherein poorly differentiated, you can't even visible any vascular vessels lumen. Fine. Yes. So these are the points you have to remember. These are the points you have to remember in case of angiosarcoma. Remember CD31 and von Willebrand factor. Thorotrast. You should remember Thorotrast and polyvinyl chloride. Repeatedly asked question. Okay, this is a repeatedly asked question. Thorotrast and polyvinyl chloride causes what is the neoplasm? The answer is hepatic angiosarcoma. Don't write hepatocellular cancer. Hepatocellular cancer is caused by what? Chronic hepatitis. That is the hepatitis B, C infection along with the, what we call it as our aflatoxins. Okay, aflatoxins are known to cause hepatocellular carcinoma. Don't write here it is hepatocellular carcinoma. It is Thorotrast or polyvinyl chloride. So with this we have come to an end. Okay, of what are the yes, the vascular tumors. You should know we have different classes: benign, intermediate, and malignant. Remember, hemangioendothelioma and Kaposi sarcoma is a intermediate variety. Hemangiopericytoma, it is a malignant variety. Okay, and there is no need of discussing that here. Then angiosarcoma, malignant variety. Rest all are benign neoplasm. Okay, thank you.